Good morning, everyone. This is Amy Landau from North Shore Acupuncture Center, and today's session is a reschedule. And so I appreciate everyone's flexibility with our rescheduling last week with everything happening in the world. But this is one of a series of videos that I've been doing with different people about being perimenopausal in a pandemic. And today we are talking about yoga for bone health. Which is very important. And for that, I have Becky Liston joining us today. So Becky, thank you for joining us. Just to give you some background on Becky, she's a physical therapist and a yoga teacher with 20 years of experience treating people in outpatient physical therapy. She spent 17 years treating athletes, runners, dancers, yogis, and weekend warriors, and 17 years of experience teaching specialized and private yoga classes. She's certified to treat women with incontinence and pelvic pain through Herman and Wallace, and to teach yoga for osteoporosis with Lauren Fishman. So we talked about pelvic health actually last week, so another resource for you guys for that as well. But today our focus is on bone health, which becomes something that's in particular more important for us, or we start thinking about it more. It's always important for us. We start thinking about it more during perimenopause. So before we get started, thank you for joining us. If you do have questions, please feel free to put those in the comments, and I will get your questions to Becky as we discuss. If you are watching this later and we are no longer live, still put your questions in there, and I can reach out to Becky and try to get those answered for you as well. So Becky, thank you for joining.
Thanks, Amy. Thanks for having me.
So I wanted to get started just to have you talk about, why should I be concerned about my bone health in the first place? Why is that important?
Yeah, it's a good question to ask really at any point. It's tricky. Osteoporosis is a asymptomatic process that happens in our bodies. So we don't actually really know or notice that it's going on until we sustain often a compression fracture or a fragility fracture from a fall. So that's kind of the whole reason that we really want to take a look at bone health and make sure that we're doing everything we can to stay as strong as possible. And it's best, honestly, to start as soon as we can, though it is great to do at any point along the way. When we are young and we're still building our bone health, like if we're building our bone strength, we affect bone strength through about age 30, and then 30 on, sadly, it starts to slowly decrease. So there is, just as a normal process of aging, there is a slow decrease in bone strength over time. So the more we can do things early in our life, bolster our strength. Estrogen factors in with, and hormones honestly have a big relationship here. But estrogen, we know, works together with stress and strain in our bones to help work on creating a strong, healthy bone. So if we think about perimenopause and we think about menopause, we know that hormones are starting to change, that our estrogen levels are starting to decrease, and it becomes even more important for us to do things that we can do to positively impact our bone strength. So that's global, yeah.
That I forgot to make a caveat in the beginning. So to your point, if you are a young woman joining us today, you're welcome as well. This is the best time for you to get started. And we also have a lot of men that have joined our calls because the topics are not necessarily specific to perimenopause. It just is something that can come up for women, but impacts everyone. So to the men joining us, you're welcome. We appreciate you joining, and please don't feel intimidated to put your questions in the comments as well.
Absolutely. And I'll just say to that point, Amy, men and women, I mean, there's a higher risk associated with fracture in women, but there's a pretty high fracture risk in men as well. And in fact, the risk of sustaining a hip fracture at some point in your life is greater than breast cancer, uterine cancer, ovarian cancer, or prostate cancer. So men or women. I feel like, and we think about this, we think about, why are we concerned about preventing a hip fracture? Well, it's not just the rehabilitation associated with the hip fracture, but as we age, the morbidity rate goes up when we have a hip fracture. So it might be a lot harder to recover from when we're older. There might be other complications, other things happening that might make it harder for us to come back from that. So, yeah.
And when you can't come back from that, it makes it more difficult to exercise. It makes it more difficult to do things that you like to do with your friends and family, all those things that impact our health and prevent all of those negative things that you just mentioned.
Yes.
So we need to be able to use our hips for those things.
Absolutely. Absolutely. And so that's just like the hip fracture piece. And then there's also, there's compression fractures that can happen through our spine. And that's something that actually working a lot with posture, honestly, at any point along the way in life is going to be helpful to do, because when we are in a flexed torso, like if, this thoracic kyphosis is probably a position that we all take when we're tired, when we're, we've been on the computer too long, we're kind of going with gravity, we're something, it's something that you will see like your kids doing, you'll see like I do, even though I know I shouldn't. And then over time with age, it becomes sometimes hard to reverse. So we might, become fixed or have a little bit more fixed posture in this thoracic kyphosis. So doing the work when we're young and we can reverse that. And even, as we age too, if you have mobility here, even if it's slight, working with that is going to help to strengthen the muscles that oppose this rounding. Because if we round, if we flex and we have weight, from gravity on the top of our spine in this position, there's more of a risk for us to have vertebral compression fractures. And that's where the fronts of the vertebral bodies get closer together when we're rounding. And then a cough, a sneeze, picking up something like that can cause enough of a load for there to be a vertebral fracture. And those are really painful and hard to recover from, and also limit all of the things that we want to be able to do, exercise, move. Breathing is hard when you have a compression fracture. So working with posture is huge and important at any point along the way in life. So
if you could sit that way again so people can see from the side, if people imagine, like if you've ever gone bowling and held a bowling ball, when you hold it close to you at first because it's heavy, and your head is like a bowling ball. So when she's holding her head forward like that, it's like if you were holding a bowling ball away from your body, instead of like normally your neck needs to hold the bowling ball like right in the center. And so a lot of people that I have that have neck pain or upper back, it's because they're going forward. And if you tried to hold a bowling ball all day like that, you would feel it if you were holding it away from your body. So
absolutely,
it was a good visual for me. Thank you.
Yeah, absolutely. Yeah, it's good for me too, because then I get to see myself and look at how bad it looks, and it's a good it's a good cue to remember to sit up straight. So it's important.
So what are the things, like how do you know if you might be at risk for osteoporosis?
Yeah, it's a good question. So honestly, with increasing age, and especially as we, reach perimenopause, menopause, and our estrogen stores start to decrease, we are at risk. We know that in time our bone density starts to decrease slowly, and that's pretty consistent across our population. If you're Caucasian, if you're Asian, you have a higher chance of becoming osteoporotic. If you're African American, you have less risk. So that's something that you can know. The more active you've been and the more weight-bearing exercise that you've done, It's going to set you up to be stronger and probably healthier bone wise. If you've done a lot, like there's a balance with exercise. Like if you reach a point where you've done too much, and how much is too much is debatable, aerobic high intensity exercise, and maybe you've interfered with your metabolism, or you've impacted your normal hormonal balance. If you've done too much exercise, you might actually be at a higher risk. If you've had an eating disorder in your life, that can impact your bone health. So normally they'll do a baseline DEXA scan. And I think that's right around 50. I haven't had one yet, but everyone that I have in my yoga classes, they're coming in with a baseline DEXA scan, and that'll give you a number that will tell you if you are kind of right around where most people your age are. There's like a standard deviation away from normal. So if you get like a negative 1.0 to a negative 2.5, you're in an osteopenic range, which is a precursor to osteoporosis. And if you get less than negative 2.5, continuing in the negative direction, then you're considered osteoporotic. And it's just kind of looking at your bone density and how far away you are from what we would call like that kind of normal place we'd want you to be. So the DEXA scan is a really imperfect measure, honestly, but it's the best that we've got right now. And it's important to know, like if you have your baseline DEXA scan and they see something like they're like, oh, you're osteopenic or you're osteoporotic, your first step might be having that discussion with your doctor. That's not like, okay, great, what medication can you put me on? They might want to have that discussion right away. But if you're in that like osteopenic or like very, very early osteoporotic range, starting with looking at diet and exercise might really help you to move in a positive direction. And then often a lot of the doctors that I know will do another test, another DEXA, and check and see if you've made improvements in a year or in 2 years. And in that window, if you're doing things like yoga, resisted exercise, walking, working with your diet, you might be able to, and it actually is, there's pretty good evidence to show that you will be able to make a positive change in your bone density. So, yeah, I don't remember. Sorry, Amy, that was a lot of information.
Oh, you just kind of went to the next question, which was, what can you do to minimize your risk?
Okay, yeah.
So you talked about some of those weight-bearing exercises.
Yeah, absolutely.
You'll notice the things she mentioned, she didn't say that you had to pick up weights and do things. She talked about yoga, walking.
Yeah, absolutely. And I'll tell you too, like the yoga for healthy bones that I'm currently teaching, there are a couple of basic principles that I feel like you can apply to your own yoga practice now, if you've got one, or if you decide to apply these to the exercises you're doing, or just kind of take it into a new yoga practice. What they've looked at in research, Lauren Fishman is a physiatrist. He's done a lot of research on bone density in yoga. He's worked together with a few Iyengar certified yoga teachers to come up with a 12 pose practice. You can find it on YouTube. I can send you a link. But with these 12 postures, they had people practice most days out of the week, so at least 4 or 5 days. They had people holding the poses for at least 12 seconds and up to a minute at maximal effort. So these were done like, not just like when you're in a gentle class or you're maybe in a class and you're just kind of hanging out in a pose. When I do the practice, I'm surprised when I really think about maximal effort, how it changes what I do. And I'm like, oh, when I practice and I'm not thinking about this, it's easy to just kind of like sink into a posture. And I think sometimes that can happen when we're just doing exercises too, to really think of using like maximal effort and really resisting muscle against bone can help stimulate bone strength. So working on those maximal effort holds, like 75% to 100% effort, and doing it for a long amount of time, not just kind of like moving in and out of the posture. Those are the things that they found to be the most important things when they're looking at their research, like doing this yoga most days out of the week, holding for long periods of time with maximal effort. So those three tenets, I think you can take pretty much to whatever yoga practice you're doing, honestly. The other things, can I tell you just a little more about the practice? So the other thing when you're working with yoga for bone health, if you have osteoporosis or osteopenia, you want to just be careful about yoga postures where you're flexing your spine and rounding. So in yoga, we do a lot of up and down movements. You might do like Uttanasana where you round. When we're really wanting to preserve the spine and we think of not flexing the spine, we do a lot of movements through the hips and really keep the length of the spine. So folding at hips, avoiding a lot of rounding through the upper back. Even in a forward fold, we would modify by maybe being halfway or really keeping that extension moment in the upper back. I think that's one of the most important things. We don't do a lot of flexion, not a rounding, but we do a lot of twisting. So we'll do rotation, and the rotation is really helpful for strengthening the facet joints in the spine. So it can be really great for hip strength and really great for strengthening the spine. A lot of extension, so a lot of shoulder blades back, arms back, extension postures. Lying on your belly, Shalambhasana or locust pose is one of the best ones for back strength. So those are a couple things I would say about the practice.
So tell people more about how they can work with you, for people that are local, and also for people that are local but don't feel like they want to go out and be around other people yet, and for people like my mom who's in Idaho.
Oh yeah, no, that's so great. Thanks, Amy. So I have right now I'm teaching yoga for bone health through Grateful Yoga in Evanston. So that's a local studio, and they're streaming all their classes. So Monday at noon, you can come to class. You can pay for a one-time drop-in. I'm in the second week. I think we're heading to the third week of a 6-week series right now. But you can absolutely try it out. And I have people, I don't know if I have anyone farther than Michigan, but Idaho, like she could totally come and check it out. So that's one option. I'm practicing out of the Heartwood Center in Evanston. So I have a couple people who have been coming in to see me individually in person. That started recently. And if people are comfortable coming in for one-on-one sessions, that's an option. Or virtually, I'm doing telehealth, so I can see people online one-on-one. And I feel like it's actually been pretty effective working with yoga online, just through Zoom. I can make adjustments and give education on postures and while we're virtual. So those are the options right now. I have also a few videos that I've recorded of these 12 pose practices that Dr. Fishman put together. He did 2 different 12 pose series, and I've just done a couple videos of myself doing the postures that I'm happy also to share with people.
Okay. So that's an option too. And what is your website? And again, if you guys have questions, put those in the comments while I type in the website for you right now.
Yeah, it's www.ptandy.com. So PT Andy, PT and yoga, PTANDY.
Taking a little time to come up. So can see that on the screen right now.
Great.
Is there any other social media that you're active in? And not that a website's social media, but is there any social media that people should follow you on?
I am on Facebook and Instagram, so those are both options. And all my workshops and upcoming events and classes are on my website, so that's probably the best way to follow me, honestly.
Okay. And if people wanted to see the videos, where would they find those? Should they just reach out to you, or?
Reaching out to me is probably best. Yeah, I think that's probably best. I have a couple things that are posted through the Heartwood site. So if they go to the Heartwood YouTube channel, they'll be able to find a couple yoga videos, but the bone health ones I have and I'm happy to share.
Okay.
Yeah.
I would suggest, unless you're really experienced with yoga, I wouldn't start with just doing the videos. It's good to have someone observe you, especially if you have osteopenia or osteoporosis, to make sure that you're not rounding too much and doing things like that.
Yeah. Thanks for saying that, Amy. I think that it's really important, especially when you're learning the practice. It's a big difference to do a twist that would be really helpful for your spine, sitting up as tall as you can and twisting like really actually axially through each level of your spine versus thinking that you're sitting up straight, but you're actually rounding and twisting. And that can actually be more problematic for your spine.
And I see people doing that all the time.
Yeah. So I feel like it would be, working with somebody who can give you those cues, I think would be the best, honestly. I feel like there's fairly good instruction. Dr. Fishman he's done a couple books and gives a lot of really detailed information on these poses. And that's something that I really gravitate to a lot. Like I really appreciate it, from a teaching perspective, being able to help somebody really find the best posture for their own body, the best way to do the pose. And there are a lot of ways to modify if you've never done yoga before. So there are ways to, it's great to be able to do these standing postures, but there are ways to modify to sitting and using a chair. Yoga is fantastic. We didn't talk about balance, but one of the great things about doing a yoga practice, if you have osteoporosis or osteopenia, is that hopefully you can improve your balance and decrease your risk of falling in the first place. So
right.
So if we can decrease your fall risk, then hopefully, the chance of you having a fragility fracture goes down. Anyway, so that's, I think, one of the biggest benefits to doing an exercise practice like yoga is you'll get the side effect of doing this strengthening work is improving your balance. So doing the exercise, doing the balance work, hopefully you improve your balance. You might find a little more grounding and centering, as well as improving your bone density and your bone strength.
Yeah, that's a great point. So for people that are on, this is where I try to use my physical therapist, exactly what Becky is talking about. It ideally is like Chinese medicine, where you use it more preventatively, or when you first start finding things before it gets serious. So you don't want to wait until you've injured yourself and need to go to physical therapy. Physical therapists can look at your alignment, look at what you do most frequently for exercise, and help make adjustments so that you can avoid having issues. So combining physical therapy and yoga gives you a great way to look at that and help give people guidance and coaching.
Absolutely. Yes. Thank you, Amy. I would love to have like a baseline assessment with really everyone in the community, just to see, right? Like preventatively, like where are you starting and what can we do to help set you up for the best possible outcome as you age. So, yeah.
And so exactly earlier when Becky was leaning forwards and doing that type of stuff, when you come in and you want me to help you with pain, and I say, I can help you, but you're going to have to, unless you change your posture or you change how you work out, you're going to have to keep coming to me forever, which is great. Again, I always tell people I have 2 kids in college. I can use the money.
Yeah.
Or Becky also has children to send to college. And so you could spend less money between both of us and have her correct the root cause. And then you can come to me later when you have something else going on. I don't need to see you for things that you can fix, working with Becky or Heather or some of the other people that we've had join, Karen.
Yeah, that's great. Yes, can wholeheartedly agree. Fabulous.
All right. Yeah, and all of us, that's what we would prefer. We'd prefer to have you come to us early, and then we would help you correct those things, and you would refer us to your friends and family versus having you come when it's too late. And, you know, we love seeing you, but we'd prefer to be able to see you and not have to have you continue to come because you waited too long.
Absolutely. Yes.
All right. Anything that we missed that you want to make sure we covered?
I feel like that's pretty much most of it. Honestly, I feel like even if you haven't done yoga before, like don't let it be a deterrent. I've seen many people over the years who have not done a practice who come in and we just start, very baseline, adapt a practice, and they've continued to practice for years. So I feel like I've got people who are coming to class who've done yoga for years and years and years and are just wanting to try to look at how they can modify their practice or work with it a little bit differently to really make sure they're addressing bone strength and bone health. So I feel like really wherever you are at on this spectrum, I think we can really work to make yoga accessible for I would say for most anybody. So feel free to reach out. It does, we mentioned in my bio a little bit about pelvic floor, and pelvic floor health. I feel like as we work with posture and awareness and alignment, we're working with the pelvis, we're working with the spine, and that can help to change the orientation of what's happening with the pelvic floor muscles as well. So the base of the pelvis. And when we're doing the classes for bone health, we're working a lot on strengthening and stabilizing the core. So working with the core muscles and the muscles that are around the spine and the pelvis interface with the pelvic floor and help to support the pelvic floor as well. So through your structure, through your alignment, through this strengthening and postural awareness, you might have the added benefit of having some improvement in your pelvic floor function. There are so many reasons that a pelvic floor might be, having issues or problems. So no guarantee. You might need some specific targeted treatment, but it can have a really positive effect working on your posture, working on your bone health, on a lot of different structures, how your breathing diaphragm moves, how your pelvic floor diaphragm moves. It really feels different to me. It just energetically when I'm sitting up, nice and straight compared to where I was demonstrating to you before, just being like rounded and collapsed down. So a lot of different things, a lot of different ways to impact your life through working with your bone.
Yeah, so yoga is like Chinese medicine. And so we're saying yoga for bone health, but when you're doing yoga for bone health, there's a lot of side effects from that. But it's not like the side effects when you take your medication and all of a sudden you're constipated or all of this. So yoga for bone health may help your constipation. It may help. It's a mindfulness practice if you're focusing on your movements and being intentional and how much effort you're putting in. That's a mindfulness practice, which could reduce your hot flashes. Like everything that we've talked about, you're going to have a lot of positive side effects as well. The only risk negatively is what we talked about, just making sure that your form is correct and why you would want to use someone to observe you.
That's right. Absolutely. Well said. Thanks, Amy.
All right. Yeah, I always tell people I tried acupuncture first because I was having problems sleeping. And they say, how much do you need acupuncture to be able to maintain that? For me, nothing. I don't need it. As long as I'm doing yoga regularly, meditating regularly, or eating healthy. And right now, I only have to do one of the three. I know as I get older, it it will have to be two or three of the three. And ideally, I'm always doing three of the three because that's going to prevent issues when I get older. But
Yes. Absolutely true. And it's a good way to think about it, honestly. Just knowing the things that you can do to help, I think is it's awareness, and that's like the first step with any of this.
yeah.
So
And thank you, Wendy, for joining us. I'm glad you're checking your posture right now.
that's great.
All right. Becky, thank you very much for joining me today. Just a quick announcement for everyone. We rescheduled the hormone replacement therapy. That will be this Sunday. And we're going to determine the time for rescheduling the discussion about sexuality and perimenopause. So watch my Facebook page for that. That will be coming soon. And if you've missed previous videos, the easiest way to find them is going to perimenopausalinapandemic.com, and that will bring you to all the videos on YouTube. So this one will get there eventually as well. So you can watch any that you missed previously there. And if you want to talk about racism, or you just want to see me be uncomfortable, my friend Queen and I are having discussions live on Facebook about racism. Our next one today is tonight at 6:00. So join me for that. Thanks again, Becky, for joining me.
Thanks so much for having me, Amy.
Have a good day.
You too.